Lung cancer is the #1 cause of cancer-related death in the United States, and it is the third most common type of cancer that is seen in the U.S. In 2017, in the United States, there are about 220,000 new cases of lung cancer that were diagnosed, and unfortunately, about 145,000 people died that year from lung cancer. And unfortunately, the 5-year survival rate is only about 20%. And therefore, it's critical for the healthcare industry to identify ways to help prevent this disease. And in this video, I discuss how effective exercise can be to help prevent or reduce the risk of developing lung cancer. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Several meta-analyses have shown that there's an approximately 20 to 25% reduced risk of developing lung cancer when comparing those people who are most physically active to those who are least physically active. For example, there was one meta-analysis of about 154 studies that included 1.6 million people, and they compared 3 groups: those who were doing high, medium, and low amounts of physical activity and exercise. And they found that those in the high group, meaning did lots of exercise, had a 23% lower risk of developing lung cancer compared to those who were in the low exercise group. And the medium level group, they had a 13% lower risk of developing lung cancer compared to those who were doing very little to no exercise. So this shows us a graded benefit of exercise. So doing a medium amount of exercise gives us some benefit, and doing a high amount of exercise do even better by reducing the risk of lung cancer by even more. How much exercise, how much physical activity do we need to do to see the benefit? In a practical way, what will that translate into? One study that tried to assess this had looked at 53,000 men and 28,000 women between the ages of 20 and 49. And they gave them a survey to assess how much exercise they were doing, and then they followed them over the course of years. And what they found after their follow-up period, about 400 men and about 50 women had been diagnosed with lung cancer. Now, what they found was so important was that men who exercised at least 4 hours a week had a significantly lower risk of developing lung cancer, and that risk was reduced by almost 30%. Now, what's also interesting is that they looked at another subgroup here where they had assessed their exercise at 2 different times, one at the beginning of the study and one about 3 to 5 years later. And they found that the risk of developing lung cancer was particularly reduced among the men who were most active at both assessments. And that reduction of risk was almost a 60% reduced risk. So this indicates how important it is to remain consistent with the exercise, and by staying physically active throughout one's life can really help reduce and lower the risk of developing lung cancer. In a similar type of study that looked at women, about 36,000 women, and they followed them over the course of years, about 15 years or so, and they asked them questions about how physically active they were, and then followed them to see how many developed lung cancer and to look at the association between the two. And what they found was that women who were doing high amounts of physical activity had about a 23% less likely to develop lung cancer than those women with low activity levels. And then what did they determine as being a high amount of physical activity? So it was those who were doing 2 or more times a week of vigorous activity exercise, or they were doing 4 times a week of moderate activity exercise. Smoking and tobacco are major risk factors for developing lung cancer, and some studies suggest that 70% of lung cancer deaths are attributable to smoking and tobacco. So it's important for the healthcare professionals to discourage people from beginning to smoke and to encourage people who are smoking to try to quit. What's fascinating is that studies have found that physical activity and exercise can also help reduce the risk of developing lung cancer in smokers. For example, in a meta-analysis of 25 studies, which included 3 million participants, they found that even in people with a prior history of smoking or even actively currently smoking benefited from physical activity or exercise. And so what they found was that among former smokers, those who were doing significant amounts of exercise had about a 30% reduced risk of developing lung cancer versus those who were not exercising. And then in those people who were still currently smoking, those who were doing high amounts of exercise could reduce their risk of lung cancer by 20% compared to those who were currently smoking and not exercising. Now, smoking is very bad and a high risk factor for developing lung cancer. But the point of these studies is not to suggest that people should keep on smoking, but how powerful physical activity and exercise are in helping to reduce developing lung cancer. Why does exercise help reduce the risk of lung cancer? It seems hard to understand, but there are several theories that have been put out there to try to explain this. The first theory is that exercise, which has been shown to improve pulmonary or lung function, can help reduce the amount of time that the carcinogenic agents from the tobacco are exposed in the lung by improving ventilation and clearance of these products out in people who exercise. Another theory, which has been shown in studies, is that exercise can improve the immune system and immune function, and by doing that can help fight against the risk of developing cancer. A third theory is that chronic inflammation can play a role in developing cancers, and exercise has been shown to help reduce inflammation in the body, and therefore the theory is that by exercising and reducing inflammation can help reduce the risk of developing a cancer. Let's wrap up this video and go over a few key points. Number one, smoking and tobacco are significant risk factors for developing lung cancer. Number two, don't start smoking, and for those who do smoke, they should speak to their healthcare professional to try to help them quit. Number three, exercise and physical activity has been shown to reduce the risk of developing lung cancer by 20 to 25%. And number four, even in those people who are previous smokers or current smokers, introducing exercise and physical activity into their lifestyle has also been shown to help reduce their risk of developing lung cancer. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.